Are you a go-getter in your profession and at home? Taking care of everyone but forgetting to prioritize yourself? Welcome to the Healthier Go-Getter, the show that brings together health professionals and wellness experts to bring the inside knowledge to empower you to take charge of your health and elevate your wellness game. Let's become go-getters for your health so that you can bring more joy to your life and your loved ones.
One of the things that I really encourage people out there is keep your mind open, keep your interests broadly and yet definedly, but keep interest and keep learning. Never become stagnant, because if you are, your learning stops. That's how my approach to my career, my life, is just keep learning from other people as I go along.
Welcome to the show. Hi, everyone. My name is Margarita with MAM Massage and Spa. Today, our guest is Dr. Dan Nguyen. He is the founder of Neuroradiology and Pain Solutions of Oklahoma. Dr. Dan is an interventional pain management specialist and a past president of American Society of Spine Radiology. He received training from UC Berkeley and then University of Illinois, Chicago, and complete his fellowship at Georgetown University and the National Institute of Health. Dr. Dan earned his medical degree from University of Pittsburgh and has 25 years plus of experience as Chief of Neuroradiology at Georgetown University and Penn State University. He is an expert in identifying the root cause of the pain and restoring his patients' quality of life. Let's welcome to Dr. Dan. Before our show started, I'd like to thank our sponsor, Elysian Wellness Aesthetics. It's a locally owned clinic specialized in regenerative and rejuvenative medicine. They are your one-stop shop to look and feel better. They offer medical weight loss, hormone balancing, Botox injections, laser service, skincare, and many more. Check out their website at www.elysianwellnessokc.com for more details about their service. They will love to see you over there. Hey, welcome, Dr. Dan. It is our honor to having you here today.
Well, thank you very much, Margarita. I'm glad to be a part of your show. This is a wonderful forum that you have created for yourself.
Thank you so much. Thank you so much. As all our listeners are go-getters, right? So I want to ask you, who inspired you to become a go-getter, and then who inspired you to get in your medical field? What are you doing right now?
Right. So, personally, it starts with my family. My father had a little education, but most of his success came through doing things, bring the opportunities to him. His interest was in the airline industry, but he did a lot of other things that resulted in financial support for our family. That was my early stage of my life. And my latter half of my life is my wife. She is a very strong-willed person, never take no for an answer. Sometimes that could be a detriment, but it is very important that you do not let the opportunity first present to you. May not be an ideal situation. So for her, she thinks of other ways and trying to solve the issues and arrive at the same spot. So I learned a lot from my wife.
Wow, that's amazing. So is that the background picture is from her?
That is true. She painted that. Actually, if you ever had chances to visit my office, you see a lot of my paintings. On the other wall, you can't see, is my daughter. Their creativity have gotten from my wife.
Wow, that's amazing. I love the painting on the flower. That's so pretty, for sure. Mm-hmm. So how you get into the field like neuroradiology, pain management?
That's a very good question. When I started medical training, there was no field called pain management. We actually was encompassed in every medical field that deal with patients. So pain is part of it. I started out as actually an orthopedic bound. I was an orthopedic surgeon bound. I rapidly found that that wasn't something at that moment in times, then rapidly kind of gradually got into the field of radiology. I subspecialized in neuroimaging. And at that time, we had in my area, there's two parts. One part was imaging interpretation, and the other part was hands-on treating patient in the field of stroke and aneurysm. So because they involve nervous system, the spine rapidly encompassed that eventually. And over the many years, you kind of, most of us, we don't learn everything from school. We kind of practical things that we've picked up along the journey. And I've dived into it more deeper and treating patients with chronic pain and acute pain. And over time, it kind of built up my skills. And it is today, it's a combination of 20 plus years of kind of exposure to patients and what they're feeling and what I can do to shut down the pain perception to their brain.
Since we're talking about in pain, right? So what are the signals that people will perceive when they feel in pain?
When there's a disruption in the nervous system, people perceive in different ways. There's pain is one of them. Certainly numbness, tingling, stabbing, pain, dull pain. Some people even feel vibrational sensation as part of disruption of the nervous system. So that just means that something in your body is telling your brain, the CPO of all these nerve signal that goes in there and to process it, and it gives you the interpretation of what those signals are. So the nerves are really conduit, of signals from the outside the body, and it goes right into your brain to perceive what it is. It tells you something is not completely right. And so that's the sense of it. And when you perceive that, something is off. And so we need to find it. That's what our practice is about, is really trying to find what's causing this issue and how do we get rid of it so that you can go back to your normal lives.
That's very interesting. So as a massage therapist, I am specialized in chronic pain, especially muscle related, right? So we find out a lot of time when clients come in, they are in pain in certain area. When they're feeling uncomfortable, it's more like fatigue, tired, very heavy. And then when we working on their bodies, we define some area the knots. So, and then they will find out that when we touch them, they feel like a pain. If we don't touch it in the daily life, they don't. So can you explain about why they feel that way?
Yeah, so certain things in our body, if you don't disturb it, it kind of goes into this steady state thing. Some people, when you touch them, it actually feels better. As a massage therapist, there are times, I'm sure you experience where you work through the muscle. It actually releases some of the toxin that's entrapped into the muscle and makes it feel better. There are other times where you touch it and it feels painful. The nerves, when it is disrupted in some manner, it causes the muscle to be tense. And with that, there's other nerves that perceive to the brain that your muscle is tight and hard, and that can cause pain signal to come back to your brain. And so it all depends on the individual, but that's how things work between the nerves and the brain. The nerve is really the end point, but it actually touches on muscle, ligaments, and tendons and other soft tissue in the body to tell the brain that something is not correct.
That's very interesting. It's really good to know, because every time I tell my clients, I would say, "Hey, we have a lot of nerve system in the body, and including the muscle, because muscle tissue is depending on the nerve bundling together, give us the range of motion, right? So sometimes when you the body is kind of like, since you have a lot of ending point as a nerve system, so they cannot precisely identifying where is the hurting because of so much things going on. They only give you like general symptoms, tell you that, hey, I'm tired. When you specific touch area, then you feel like, okay, that's the area that are hurting. But I just want to, the reason I'm asking is I want to make sure that I explain the right thing, Yes, thank you so much. So the other question I want to ask you is like, since your background from medicine, right? You learned the medicine and then come to the neuroradiology. So what are the transitioning from those things to be where you are right now?
Today, there's actually a formal track for pain, but when I started, there wasn't. And so it really takes the interest. Most physician who goes through the process, learn basic stuff doing medical school. But as they come out and they practice, they discover there's some part of medicine that they really, really take interest in there. And then they dive deeply into it and learn more about it, which in medical school, you just don't have the opportunity to do that. But as a practice physician, you take interest in certain things and you read more, you become more educated with that subject. And over time, and in many years of applying that learning paradigm, you develop interest and specialize in that arena. For me, it just makes more sense with my patient that I have in front of me. They have a problem that's just not isolated to what I was doing, but more other things. And a lot of them come with pain. And over time, I see over and over the same thing, that you develop a interest and then also a possible solution. Because, there's every day, there's new thing come out. And if you keep track through either your reading or your exposure at national meeting or your colleagues, you tend to pick up a lot of new things and you go, okay, wow, this new treatment, I have a whole bunch of patients that I didn't know about how to proceed. Now I can apply these new things. So one of the things that I really encourage people out there is keep your mind open, keep your interest broadly and yet definedly and keep learning. Never become stagnant, because if you are, your learning stops. That's how my approach to my career, my life is just keep learning from other people as I go along.
Wow, I love that. That's very good because we want to keep growing, right? Yes. And the learning, that's how you want to go for sure. So the other question I want to ask you is what are the common patient or common symptoms do you treat at your office now?
Our office, I believe, is the most well-rounded in the Oklahoma City. I would compare this to any other practice around the country. We treat everything that's pain related, starting from the top, your head. We treat headaches. We treat the spine. We treat joint pain, shoulder pain, hip pain, pelvic, and then peripheral in the extremities, hands and legs. So everywhere, I think there's pain. We have a solution, or at least we have the ability to go find the source of the pain, and then we apply some of the things that we know that are available for that patient. We stay as broadly, and yet we're in tune with many other treatment out there that are available for deliveries to patients.
Mm-hmm. Can you expanding on a little bit on what type of the treatment that you are specifically will apply to your patients?
Yeah. So one of the things that we do here is that, we do everything like I mentioned, but, one of the things that we're passionate about is vertebral compression fracture. Osteoporosis is a huge medical need out there and underserved, really. We have chronic disease like heart disease, diabetes, hypertension, and COPD, stuff like that the medical system tries to adapt treatment for patients. But then during that process, we don't think about your bones. Your bone is one of the biggest organs in the body. and it needs attention too. And as you age, your bone gets weakened, and then they fracture, especially in the spine. And when fracture, it hurts, and it can cause neurological impairment. So we treat those vertebral fracture very aggressively. We treat it by a procedure called kyphoplasty. We also trying to treat the medical issue too, osteoporosis. The underlying cause why the bone fracture is osteoporosis. So we try to educate the patient that we need to treat that simultaneously to the compression fracture of the bone.
I see. So when you mention procedure, like what kind of procedure? Whenever you're saying the procedure, everybody was thinking about the surgery, right? It's like big invasion, like anything like that. So what kind of the procedure that do you do?
We do from very minimal and to not so minimal, but not quite, we can explain that borderline. For example, yesterday, I have a patient that has seen everybody around town with chronic pain. And he is just in debilitating pain. And we decide that, okay, he has too many things happening, and he's taking high level of narcotic pain medication, which is getting dangerous because it affects your mood, affects your daily function. So we, after looking at his records, what they've done elsewhere, well, we decided the best thing for him right now is treat his pain, overall pain. He has pain everywhere. A few weeks ago, we did a trial where we inject small amount of medication, 100 times as much as he takes by mouth. We give him a very small amount, but we deliver into his spine where the nerves are. We spoke about the nerves perceive pain. We give this small medication into the spine, and for the first time, I've never seen him smile. I mean, every time I see him in the office, he is in pain and he has that look of pain. When I gave him this medication, it's for his trial, he was smiling. He acted like normal because of that successful trial. Yesterday, I implanted a small pump into his body so that we can deliver these pain medication at like I said, 100 times less the amount you take by mouth, and to the right spot, and to deliver, to give his life back. These are the example of patient that we see over and over, and when we treat them effective, they're a totally different person. So that procedure is surgery, but we do much less things. Our field is expanding to encompass little injections to something more invasive, where the incision is small, not big time as traditional surgery you think of. I don't know if that answers your question, but so it really depends on what we do, but it's very minimal invasive to surgery like we did yesterday.
Nice. So in terms of medicine, people always thinking about when you're taking the medicine won't only last the time when they are effective. When the medicine is gone, the symptoms is still coming back. So with the medicine that you injected, how long does it will last? Will that going to be fixed roots of the problem for your patients?
Because his pain is so overwhelming everywhere, the way to fix it is at the nerve level. So the medication we gave is very through a pump. It's a small device that connects to a tubing that sits inside his spine. We deliver small amount. It goes right into all the pain receptors along the spinal cord and nerve roots. We deliver small amounts, so you don't have the side effects as if you take one by mouth. When you take by mouth, it goes through your gastrointestinal system, gets absorbed, and then it goes throughout the body. So while it helps with pain, because it goes throughout the body, it has other effects that is negatively impacting your daily life. It makes you sleepy. It makes you groggy. Yes, it decreases your pain, but you have other secondary issue of that medication you take that goes systemically to the body. What we did, we focused right into that area, so it would relieve the pain without the big side effects that you take by mouth.
I see. So after that's the medicine injection. So what are the steps for him to like really define the roots of the problem and help him that restoring his life, and he don't have to have those treatment again or anything like that? Yeah. What are the action plan that you set up for him?
Oh, we follow him. Every patient comes to our practice. We're not a one-time deal. We do follow our patient to see what else comes about. For example, that patient, most of the time we see him every so often. He will come in every 3 months or so to get his pump refill, kind of stop at a gas station, fill the gas. And we just make adjustment as we go throughout the next, some of these patients were partnered for years, if not decades. As he gets older, other things come about and we solve the problem there. But right now, our goal, because he's been at pain so long and without any intervention or any medical therapy has helped other than this pill, and it only helps partially, like you mentioned, we want an effective way that gets him back and reclaim his life again. And so that's our thing. And then we'll just follow, and whatever comes about, we'll deep dive deeply at that time. Feel pretty confident he's going to be feeling very well starting today with what we gave him yesterday.
I see. So yeah, that's very interesting to see like what are the practice that you're doing there for sure. So is it injection is the only thing that you do for the pain management?
No, we don't. We use injection to a portion of it is to help to decrease the local inflammation, but we also use injection to troubleshoot where is the pain coming from. If we injected that spot and the pain goes away, we found the problem. And then we apply our treatment toward that area. Like I said, there are some injection, like you hear epidural, it helps to calm things down. And some people, that's all they need. But others, we have to go dive a little deeper, and we use injection therapy to go find the location of the pain, and then we apply what we know to treat the pain after that through our various methods of minimal invasive procedure.
I see. So in terms of injection, do you also do like steroid shots? The people who have shoulder issues, a lot of times the doctor gave me the steroid shots, I feel better. Is that something you do too?
We do the injection, the steroid areas. And sometimes, as you know, your muscle, it gets overreach. You do something, you do too much of it, or you injure, you cause partial tear, and that becomes a painful situation. Believe it or not, your body has a great ability to repair itself if you give it time. And so sometimes the steroid injection is our way to buy that time for your body to heal on its own. And so we do try to give your body your God-given ability to heal yourself, and through those steroid injection. After a finite amount of time that doesn't help as long as we wanted to, then we elevate that to the next level of treatment.
I see. Yes. So now I want to ask you, like, I have a client who has a job that he is a pilot, and then he flew a lot. And then also in the same time that he had a car accident. So he has fractured on his neck and then his lower back, and it will cause like a herniated disc. And with the job that he has, so some of the things that he do has a lot of turn like this. So his neck just like aggregates a lot. So like in terms of like that, if the patient come in like this, how would you helping them?
Right. So just a neck as an example. So looks like he may have had some either degenerative or some traumatic event that happened in the past. So over the many years, of that, and he lived with it. Other things, your body tends to try to protect itself by develop more bone to the area to protect the weakness the initial incident caused. And with bone formation in the area, depending where it is, it can cause things to get obstructed. Or with certain, say, discs that got degenerated, it put more strain on other areas of the neck, like the joints. So we have to identify what are his symptoms. If it's just neck pain, it could be due to advanced arthritis setting in the joints. And so we would do some injection to pinpoint what levels the pain is coming from. As you know, in the neck, you have 7 segments. So we have to find which of those that are causing the pain. And so we do those injections. And say, example, if it was arthritic pain that's causing them, well, we will block the nerve supplies to those joints through the injection to see if it works. If it does, we have some tool. It's a specialized needle we place next to those nerves, supplied to the joints only, and we apply heat to it. And what that does is it stuns the nerve, and it stops sending signal back to the brain about the arthritic joint pain. So that's just an example of that. We have other treatments similarly for disc herniation as well, depending on how it looks on the imaging. One of the things my partners and I strive on this is that we always look at the films. We don't depending on someone else's interpretation. And that's what I think is so important in this field is that we need to look at the films that the patient has with them and infer what's going on with the patient with those imaging. And then we start our treatment.
I see. When you say for film, I mean MRI, or what kind of things that you're talking about here?
I'm sorry, I used the word film. I've been practicing for 25 plus years. So back then, every imaging was on a film. Now it's all digital. It's just but yeah. So we evaluate the patient, and then we order imaging study, whether it's X-ray, CAT scan, MRI, or other advancing imaging. And we're familiar with all these things. What each of those imaging modality will give the information. As a trained radiologist, that was one of the things that I find a natural flow into this is interpret the films and know the limitation of that. So that's why we order. We would order those. If they haven't had anything that's recently applicable to their problem, we order. We don't mess around with that because that's an important piece of information we need to solve the problem.
Yeah, that's very, very good. So now we're kind of in the middle of the session. Now is my advertisements time. My job here is helping you guys motivated, entertained. So now I want to ask Dr. Dan, you need to contribute a little bit fun fact about yourself. What do you like to do for fun?
Well, as much as I work on my days, I actually like to relax with movies. I mean, I love movies. You can ask my wife about that. Sometimes too much. And I like to read too. I mean, I like to read certain things about unrelated to medicine. And I love playing tennis with children. And recently I just picked up pickleball. That's something I never thought I would do because I thought I was going to interact with my tennis game, but it's quite a lot of fun.
Hey, what is the difference between tennis ball and the pickleball?
That was my question too, because I go, the ball is different, the paddle is different, versus a racket. Racket is lined with strings, and the ball is cushiony, and the court is bigger. Pickleball is a paddle, one of those things that you use to, there's no strings. It's a solid wood structure, or not wood, but it's a solid structure. And you hit the ball, which is a little harder than the tennis ball. And so, the hardest part is that I was trying to overswing. I thought I was going to hit hard, the ball would travel hard, but it actually doesn't travel that fast as a tennis ball would be. So you can get hurt. Actually, people have gotten hurt. I've seen some people in my practice hurt from pickleball.
Oh, really?
Yeah, and you think it's a milder sport, but people get into it and overswing and all that stuff and create all the tension in their shoulders and knees and hips. Yeah, you can get injured with pickleball.
Wow, that's amazing to know. I guess you need to wear a helmet everywhere. You won't even play the pickleball, right?
Right.
Yes.
I haven't seen head injury, but I suppose it can cause some ding in the head if you don't watch what you're doing. Yeah, things travel pretty fast.
That's very interesting. Oh, I need my boyfriend always want to make me to play pickleball with him. I tried, but just not a good idea. But I need to be more practice, and then we can be able to play together, or with your wife or kids. Have some fun together for sure. And so now let's get back in the show. So now I want to ask you. You mentioned you also treat the hips issues, right? I have some of prenatal ladies coming. They have like very pain on their hips area. I don't know if you helping with pregnant or post pregnancy, something like that.
Yeah, we see some of these patients here. So when you're pregnant, your body prepares for delivery. And prepare your pelvis, a woman's pelvis. And so what it does is it secretes some substance that causes some of the structure to be relaxed a little bit so that the baby can be delivered through the pelvis. During that process, after pregnancy, on some people, it was too relaxation, and now their pelvis becomes unstable and painful. So there's a subset of those patients that we see. So it could be the hip, but it could be other structures. So one of the things we evaluate is when it's hurting below the spine, what is it coming from? Is it the joints of the pelvis, or is it internally? And again, pelvis is rich with nerves as well. And so there's things that we do injection-wise in the area to find which joint or which nerve or something in between that's causing this pain. And we also obtain imaging, such as CAT scan, MRI of the pelvis, to look for anything that's abnormal before we dive into finding out what the underlying cause is coming from, so that we can have a plan of attack, so to speak, to decrease their pain.
I see. So does all of the injections safe for pregnancy?
Yeah. Good question. If you use it for pregnancy, there are things that we can limit it to. We have to consider weight in the baby too. So there are different ways to guide our needles. One is fluoroscopy, which is X-ray. The other one is CAT scan, which is also X-ray. And the third one is ultrasound, which is not X-ray, which we relied on. We had to guide it to certain nerve area as well. So we have different modality to guide the needles, and depending on where it is and the situation. Sometimes we go, okay, you're about to deliver. Let's wait until after the pregnancy, and then when your baby is already delivered, so that we can explore more deeper in there through other injection therapy that doesn't have effect on baby, because a lot of things are unknown. We don't want to subject the baby to any of the things we do, either directly or using some of the imaging guidance to guide the needle that will affect the baby, because that's very important as well.
I see. So I guess all of the pregnant lady, they want to know, like, whenever you naturally deliver the baby, and then your pelvis bone, they will come back. But some of the people, they are not, like the bone is still shifting, still not in place, and it causes like sciatica pain, everything like that. So what is your interpretation on that?
Yeah, so there's certainly sources of pain if they deliver naturally. There's sometimes it's due to the pathway of delivery where there's some injury that occurs. So those things we work with the OBGYN to see if there's anything that we can that they can do first, to treat some of the anatomic injury that occur with natural childbirth. Once that is implemented, and it isn't, then we have other ways we can look at. There are nerves in the pelvic floor that we can explore. There are joints of the pelvis that we can explore to see. One of it is the sacroiliac joint, which is the joint. You have two of them, one on each side. That can become loosely, it becomes a little loose after childbirth. And so we can explore if that's a source of their pain as well.
I see. So, yeah, this is great. Thank you so much. So now, what are the self-care tips that that the people can take away from you so they can practice at home?
There are things you do in terms of exercise and to increase your range of motion, because range of motion is what you want to preserve. As you get older, you lose some range of motion. So some of the exercise that they're out there, or some kind of therapy that you see at the local gym or at some YMCA, they have these programs where you become more active. The last thing you want to do is be stagnant, sitting on your couch all day long. So you want to have some kind of exercise regimen in your daily life. The other aspect is I'm kind of passionate about bone. You are what you eat, so to speak, So the bone is developed because through the nutrition that you give to it, the bone developed at its greatest during the early 20s. So during your teens and that, this is a time when to feed your children with all the nutrients that required to build the strongest bone. Because if you build, that's your framework during your youth. As you get older, it decays much less at lesser rate. So you don't lose as much. I encourage parents to help their child eat right, feed their bone, and for that's on the spectrum of the youth. But on the elderly side, as you get older, remember to discuss with your doctor about bone health, because they'll forget about it. They're so busy with everything else. You want to talk about there's a time and place, depending on your family history, where you become, you need to be assessed your bone health. And you can discuss that with them. And they can order some basic scan to grade where your bone health is at. How much bone strength do you have? So there's such a study out there, but it needs to be discussed. Otherwise, it's forgotten. There's so many other things we have in health. Mm-hmm. So that's one thing I want to encourage is that think exercise and also bone, either nutrition and bone testing to determine where you are in the spectrum of bone osteoporosis.
Nice. So what about, is there anything that they can be able to do some care for their nerve system? Is there anything that would help?
There's a lot of things that people have done. I don't think that there is everyone's different. So there's something that you can take that's a magical pill to reverse or to slow down certain things. I think it's a combination of many things. One of it is just genetics. Everyone's is different. And so all I can say is eat right, exercise, and just make sure that you keep your regular health checkup and do things that's fun for you. Keep your body in a good range of motion and fitness. As you age, things you'll be able to handle some of the injury better.
I see. Yeah, is that because like nerve system is very hard to predict, right? So there's so many, and then which one is good for that? It's very hard, and then in the same time you don't want to like hurting it in the sense, right? That's why there's not such magical pill for that to do like self-care on that.
No, there isn't. It's just overall kind of how you live your life. And, of course, if you love dangerous sport, you're going to tend to be probably could be injured more, it really depends on how you weigh what's your benefit and risk in everything you do, so don't go out and I'm not saying that you can do it, but don't go out and decide to jump, skydiving, as your hobby, because, that comes with risk, certain kind of risk.
Yes, definitely. Hey, so what make this show different than any other show is like all our guests will treat with a massage session from MAM Massage and Spa. So how was the massage session with you and your wife?
Well, we thank you for that opportunity. My wife really, really enjoyed that day because she had a kink in her neck, and that you obviously solved it that day. For me, it was incredible. The muscle tension that I have, that you helped to relieve it quite effectively. So I really enjoy it, and I want to thank you.
Oh, that's awesome. Thank you so much. Yeah, so now I know that you're going to speaking at our chronic pain event on November 4th. So this is the question is for our audience and what they can take away from that speech.
Yeah, I'll be lecturing on some bone health and some of the things that you may have every day. You live with pain. I may want to propose you some other ways that we have that you can consider if it works for you. So that's one of my challenge is I want to spread the word out there to people that there are other things that we can do to divert the pain perception away, other than what people are afraid of is the only option is surgery. So there are things that we have now that we didn't have 10 years ago, and people certainly don't know it. So my hopes is present that to the audience and discuss about it. At least you're aware there are things that we have currently to treat the pain that you may have.
That's very amazing. So I want to expanding on that, ask you like, were you gonna explain about the nerve system, how the pain signal will transform into your body, and how the thing is going to work on the nerve side, the part two?
Yeah, I'm gonna briefly go through at a basic. I don't want to dive too deeply, and then I'll lose everybody and everyone. But just some basic tidbits on how pain is perceived and how we can do to divert the pain away from that perception. Yes, I will do that.
Nice. I think that's going to be a lot of benefits for them to understanding, like what is the pain come from, and then how does the nerve will really give you the signal, and how that's going to affect, and they are so they can be able to more informed, so I understand which one is the best way to helping them. So that would be awesome. Yeah. Thank you so much, Dr. Dan. Is there anything else that you want to discuss with our listeners?
Well, I just mentioned that, approach life always with openness, keep your ears, your eyes, your sensory open at the opportunity that may present you, like meeting yourself. We met through inadvertently. Keep those opportunities and expand on that, because you never know what other doors might be open through those contacts. So I encourage people to just kind of be welcome to those opportunities as it presents up through their life, and see where it goes and be open about it.
Yes. The other thing is like Dr. Dan is very kind. If you have any questions or anything like that, definitely visit their office, which is in Edmond, Oklahoma, right?
Yes, we have an office. We have a website, on the social media quite often through Facebook, LinkedIn, and Twitter, or what they call X now, and other social media. And then our website, we have that, and we have ways that you can contact us. Sometimes we can't answer everything through that medium because of certain privacy rules. So we may keep it brief for that reason. If you want to dive into more, maybe we can perhaps set up a consultation period where we can dive into deeper about some of the issues that you may have question about.
Yes, yes. And maybe play the pickleball with him. You never know when you're going to find him on the pickleball court.
Yes, yeah, that'd be fun. Yes.
Yes, yes. Anyway, thank you so much, Dr. Dan. I'd like you to get back with your practice. I know you have patients coming really soon. And thank you so much for your time.
Well, I appreciate for this opportunity. I look forward to work with you and any other community service around town.
Yes, definitely. Man, we're good.
Remember, being proactive about your health is the first step towards a brighter, healthier future. So until next time, keep that go-getter spirit alive, stay proactive, and never stop pursuing your wellness dreams. Connect with us on Instagram at Healthier Go-Getter. Check out more great interviews at mammassageandspa.com or follow us on Spotify, Apple Podcast, or any other podcast platform. This show is for educational purposes only. Contact your doctor or physician for any health concerns.